Hello, welcome to day 9 of OET Learnuary. It's me, Sona here from Bose Learning. I'm a premium preparation provider of the OET. For those of you who don't know what OET Learnuary is all about, well, every day this February I'm posting a video to help you on your OET learning journey. So you can watch our videos, gain new skills, practice vocabulary, pronunciation, and get tips and advice on how to upgrade your OET. Today we're going to be looking at some useful expressions for the OET vocabulary, and it's a great idea to use everyday lay language, and this includes phrasal verbs which are less formal, so you can explain more medical terminology in an easily accessible way for your patients. So we're going to be looking at a case study from guidelinesinpractice.co.uk. Just to remind you, I'm not a healthcare professional, I'm an English teacher, I'm a premium preparation provider of the OET. So all my material comes from reputed sources such as this one, and I put the website on the screen there, and I'll also pop it into the information box so you can take a look yourselves. In this blog post, Dr. Sonia J explains the importance of considering and excluding sinister causes of unintentional weight loss. Sinister, of course, means worrying in this case, and we're going to be focusing on weight loss. There's a case on here, case number 1. It's quite long, so I recommend you go and have a look at it yourself, or you just press pause and you can read it now. But if you want a summary, this is what it is. There's a 54-year-old female who's healthy, she's a regular gym goer, and earlier in the year she was diagnosed with borderline glycated hemoglobin. She was referred to a diabetic program, which she engaged with well. And then she returns to you sometime later and mentions unilateral breast pain. You notice that she looks much thinner than she was at the start of the year. You take her weight and it's actually 20% lower than 1 year ago. She states it's because of stress and she can't eat properly. Her breast examination notes a small area of nodularity but no overt mass, with normal skin, nipples, and no auxiliary lymphadenopathy. Now your task is to refer her and to explain to her that you're going to refer her to the breast clinic on a 2-week wait pathway. This is the most urgent pathways in the UK, so when you really want the test to come back quite quickly. And you're also going to send for repeat blood tests. On the OET speaking task, you may get something like this. Explain to the patient that you need to refer him or her to the breast clinic. Of course, this case is about a female, but in the OET, they'll always tell you him or her because we don't know who the interlocutor will be. So refer him or her to the breast clinic on a 2-week wait referral, which is urgent, and for repeat blood tests. So how can you do this? How can you explain to the patient that this is what you need to do? Can you try and fill in the gaps? Okay, so you could say something like this. I'd like to organise, or you could say order here, a couple of tests for you. The first one, so this is your organisational skills coming in, so you're telling the patient that there's a couple, and the first one is to refer you to the breast clinic. And can you spot the phrasal verb here? And I'm going to put down here that it's an urgent referral, okay? So put down means to make a note, to indicate that it's an urgent referral, but you put that into lay language and say put down here. So it should take no longer than 2 weeks for you to be seen. We've got our use of the passive here because we don't know who's going to see your patient. Then I'd like to take some blood tests again to see where we are at the moment, to see the current situation. Now, Imagine you've told the patient this and the patient might be quite worried. So why do we need urgent blood tests? What's so important? It needs to be done on the most urgent pathway. Maybe the patient is worried that they have breast cancer, and you need to reassure the patient that the tests do not necessarily mean that the patient has breast cancer. And you want to use the phrasal verb rule out, which of course means to eliminate. How can you do that? You could say something like, there is no need to worry about anything at this point. The tests are just so we can rule out anything sinister. Rule out, exclude anything sinister. So again, we're changing a medical term into a phrasal verb so that it's everyday lay language. Here is the outcome. So again, if you want to have a look, you can still this and read through what actually did happen in this case, or go onto the website that I have put down into the information box and you can read all about it there, including some other really interesting cases as well. Thanks very much for joining us. I hope to see you tomorrow for the next video in OET Learnuary. Don't worry if you haven't seen the previous ones, go back and check those. And if you've done all of that, why not go back and check one of our other videos as well? We've got lots, so there's plenty to keep you busy. Thanks very much. See you next time. Bye-bye.